Hello, my name is Gemma New. I am the Band 7 Practice Development Lead Midwife at Portsmouth Hospital's University NHS Trust, and today I will be delivering the exposure workshop, and this includes the head-to-toe assessment, AVPU and pupil response. As previously discussed, we will be focusing on the A to F assessment, and this presentation workshop will focus on the two areas including disability and exposure. When thinking about disability and the assessment of the mother, we focus on the assessment tool AVPU within maternity. As you can see, this is broken down. A corresponding to alert, so if the mother is fully awake or if she is asleep, she is able to remain in an alert state when woken up. Voice V is voice respondent and will make some response when you talk to the woman. P is for pain, and this is if a mother only responds to a low level of pain stimulus. And U stands for unresponsive, where there is no response at all. If you make a neurological assessment and the mother is deemed as P or U, i.e. pain or unresponsive, you must ensure that the mother has a patent airway and seek further advice and escalate as appropriate. When thinking about neurological assessment, we also use the pupil response and dilation in terms of neurological output. So as you can see, there are several pupil responses diagrams on the PowerPoint. So as it reads, if you have one acutely dilated pupil on one side, this can indicate things such as a tumour or an abscess or a brain hematoma. If you have constricted pupils on bilaterally, this may indicate analgesia, so particularly opioids, or it may indicate some kind of neurological accident. Or if you have bilateral dilated pupils, things that can cause bilateral dilated pupils include stress, anxiety, but also fear. And other things to take into account is recreational drugs or potentially an overdose. Another assessment that we use within the disability category is glucose monitoring, and often this can be overseen or overlooked when we're doing our full assessment. So if you are concerned and have an unwell mother, then don't forget to check the blood glucose. So all mothers with a blood glucose of less than 4 should be treated accordingly to your local management guideline. Also, just to constantly think about that airway, to ensure an airway is patent and open. If you are ever concerned about a mother's airway, then just think about the oral treatment in terms of hypoglycemia may not be appropriate. So to follow your local guidelines in terms of IM medications. And also think about if a mother has not been eating for quite some time or has been nil by mouth, think about additional supplements that the mother may need, and also contact the dietitian or other members of the MDT team that may be able to support you with this. Moving on to exposure in the assessment, this really is a head-to-toe assessment of the mother, a focused examination, and really to do a top-to-toe assessment of anything else that hasn't already been covered. So thinking about indwelling or external devices, including catheters, drains, cannulas, IV lines, epidurals, obviously the monitoring of blood loss and PV loss, ensuring we have a strict input and output chart, looking at the mother's skin for any changes in the skin colour or any rashes that may exist, moving on to any wounds, whether that be an episiotomy or perineal trauma or a section wound or any other wound, possibly from a drain or any other devices. Also ensuring that we do a full assessment of the legs for any signs of DVT, so any swelling, red or warm areas or pain that the mother may report. Also within the exposure part of the assessment, it's really important to consider pressure area care. So here at Portsmouth Hospitals Trust, we have implemented a maternity specific pressure area assessment tool that any mother that triggers pressure area care, there is a bundle which we follow and use as a risk assessment. All women that enter the labour ward should have a risk assessment completed on admission. The cohort of women that are at high risk of developing pressure sores, ordinarily we would do as an interactive session, but just to keep in mind raised BMI, any kind of pre-existing skin conditions, immobility, and anything that affects the hydration of the mother in labour. And also, in terms of the assessment, it's important if they are identified as high risk, what our clear management and referral pathway would be for in terms of contacting tissue viability if required, and how often we will be monitoring the pressure area care. Last but not least, and very importantly, is the monitoring and strict monitoring of fluid balance. So thinking about fluid balance and why it is important, on one end of the spectrum we need to ensure that women and mothers are adequately hydrated, so we want to prevent them from becoming dehydrated, whether that be in the intrapartum or postnatal period, but particularly it's very important for when we're thinking about women who are sick. And also on the other end of the spectrum, we need to do strict fluid balance to avoid fluid overload, particularly if we're caring for women with PET or who are on strict input-output. How do we monitor fluid balance? So each local maternity unit will have their own monitoring assessment tools, so they can be in the form of input-output charts, whether you use an AOU or an HDU chart, which will have your hourly input-output, thinking about whether you need to use a urometer for the monitoring of urine output, and this needs to be documented in whichever form is within your local trust. What fluids do you include? So we include all fluids regardless of the route of administration. And the route of administration, there is IV, oral, particularly if we're looking after sick women, there may be other routes of administration, including nasal feeding tubes. And when we're thinking about the types of fluid loss, we really need to be thinking about the wider route. So input, we are monitoring all oral fluids, any kind of IV fluids that may be going in, blood transfusions, whether there'll be medications, antibiotics, any kind of feeding lines, we need to include all those types of fluid. And also when we're thinking about output, we are monitoring very closely the urine output, which I've already discussed and touched upon, a urometer if applicable, any kind of stools. So if a woman has a PPH and has medications that may change her bowel habits, then we need to be monitoring that very, very closely. Vomits, we need to be measuring any vomit and measuring this correctly and inputting that on the chart. Blood loss, and any other loss as well. So if we have women that are particularly unwell, we need to take into consideration that they may lose loss through other methods. Thank you very much for listening today, and I hope you found the workshop beneficial. Please don't hesitate to contact me if you have any questions. Thank you.